Hello again for the last time. This is Ross Bindler. I'm going to be showing you the LexiComp drug database. This is the last of the three that we have access to here at WSU. So this one's run by Walters Calor, and it's used in hospitals, health systems, and it's targeted at pharmacists, physicians, nurses, and students. Um, Most of this stuff is well respected, and it seems to be a pretty good resource for most people. So to get to the LexiComp, from here where you have been getting to clinical pharm micromedics, you'll look down and see LexiComp online, StatRef, and others. Let's click on that. It'll take you to the web page for our new librarian. Her name is Electra Enslow. She's a very nice lady, and she is taking over for a couple of long-time librarians that we used to have here. I would recommend bookmarking this page. As you can see that I have bookmarked it. I use this page quite often. It has a link to PubMed. It has a link to the International Pharmaceutical Abstracts, to SciFinder, to LexiComp, which we'll be looking at here in a minute, to our StatRef, to our Natural Medicines Comprehensive Database. These two natural medicines have combined and become one. The Cochrane Library, which is full of meta-analysis. Web of Science, which is kind of like a PubMed. But then also down here, if you click these links, it'll take you back to that other page where we accessed them originally. So LexiComp here, you just click on that. It will ask you to authenticate, so your network ID, your password. And here we go. So we were having some trouble accessing this off campus, but obviously now that's not too much of a concern. I am at home and being able to access it here, so you all should be able to too. One thing to point out, the news articles are here on the right hand side. Special alerts are also there, and they have a wealth of training information. This is like a 43-page, 53-page resource guide. All their updates, and they also have training videos. So you can browse by the general categories such as drugs, diseases, toxicology, which is very important, patient education. If you want to give the patient a form and you need something to print out, come here, look up the drug, and then send it on them. Laboratory type stuff and international drug lookup. If someone from a different country comes in and is trying to get their medication filled, but you have no idea what it is, this is a resource that can help you with that. There are some other ones over here, but we'll focus on these main ones. So first, just in the center here, let's enter our first drug. Let's stick with atorvastatin. So here we go. It actually has a player, so
atorvastatin.
It tells you how to say the word,
atorvastatin,
which is really cool because some of them, when they first come out, no one has any idea what it is. And then down here on this side, there's a lot of expandable ones. So let's say interactions. It'll take us to the interactions, but I want to know drug. I don't care about the metabolic transport effects. I just want to know about the drug interactions. So then you can kind of keep narrowing it down into what information you're looking for. And it just has all these interactions in the risk level. If risk C, monitor therapy with dabigatran. With fluconazole, fluconazole may increase the serum of concentration of atorvastatin. It's risk C, worth monitoring their therapy. With fosphenytoin, it's a risk D, so you might consider switching the therapy. And with a few others, you'll see an X, like with gemfibrozole. It's an X, avoid combination of the two, so they shouldn't even be used together at all. Essentially, this is a book that they've put together piece by piece. So there's a lot of stuff that's in here, and you just kind of have to open it up more and more and more to get deeper into it, to find more, more intricate information. So we could do an interaction check like we have with the other ones. Can also do drug ID like we've done with the other ones. Clinical calculators like we've done with the other ones. IV compatibility is very unique in this one because it uses the King Guide, whereas both Clinical Pharm and Micromedics use Trissel's guide. So sometimes if you're unsure, it's best to check two separate ones. So checking the King Guide plus Trissel's would be a good idea in that case. The patient education sheets and the toxicology is very unique on this site. The only bummer with this site is LexiComp doesn't give you a free app. You still have to pay for it. So, and it's a yearly cost. But they just came out with a standalone clinical pharmacology app, and as I showed you before, Micromedics has all those apps to the side. So, so let's look up. We're in patient ed. So this gives you the patient ed, but let's go to LexiTalks and let's look up atorvastatin. So they don't have anything besides atorvastatin mixed with amlodipine, but let's click on that anyways. So the terms that it's indexed under: it's contraindicated during breastfeeding. Amlodipine is excreted in the breast milk. Excretion of atorvastatin is unknown. But so since the calcium channel blocker is being excreted in the breast milk, it remains that you're not gonna, it's advised to not do that. So let's look up clonidine, which is an alpha-2 agonist that you'll learn about in your sympathomimetics lectures, your autonomics. LexiTalks clonidine. So it's an alpha-2 for hypertension as well as many other things off-label, such as nicotine withdrawal, severe pain, dysmenorrhea, menopausal hot flashes, ethanol dependence, on and on and on. So there's some common signs here of overdose on clonidine, dermal, what happens to the skin when you have the topical patch on, and the mechanism of toxicity that occurs. Treatment is major stabilization. Make sure that they can breathe, that they have plenty of fluids, that kind of stuff, and wait it out as the body clears. And decontamination they can do with gastric lavage, so they suck it all out, do the tummy suck, or they can give doses of activated charcoal. That only works, either one only works if there's still stuff in the stomach. If it's been too long and all of it's been absorbed, then that's not going to be a successful way to treat. And there are no antidotes for it. And then it goes into some of the symptoms and how to treat the symptoms of clonidine toxicity, and then how the patient should be, their disposition, then the pharmacokinetics and pharmacodynamics of it, breastfeeding considerations, any additional information, and into the dosage forms. So you can kind of see how the LexiTox is put together, and that's pretty unique to this database. I didn't want to go through all the same stuff because we've already done that on the last two. So if you have any questions on any of these databases, please feel free to see me. Again, my office is Health Science Building, HSB 210E. And I'm in there most of the time. If I'm out of there, I'll generally be right back. And I'm more than happy to sit down and go over some of this stuff with you guys. So I hope you have enjoyed my presentations, and I will leave it there. Thank you for watching them.